Hello and welcome to our very first Heart of Medicine interview. We're very excited to have done this first one with Teja Jaensch, a Chinese medicine practitioner and also student of Yaron Seidman, the founder of the Hunyuan Research Institute in Connecticut, and along with Yaron is the co-author of their book Hunyuan Xinfa, The Lost Heart of Medicine. And it was this book that inspired Jane and I to kick off this whole project. So it's very exciting to kick things off with him. We were very lucky to spend over an hour chatting with Teja at his beautiful clinic, Point Specifics in Kellyville, Sydney, that he runs with his wife Jacinda. Since it was over an hour, we have decided to split it up into two more manageable bite-sized pieces. So you can expect the second part to be posted up here in about a fortnight. In this first 30 minutes or so, we get a really nice introduction into how Teja came into Chinese medicine from originally a background in Kung Fu, and the connections that he's made between medicine and martial arts. He also very generously shares some recent personal experiences as a patient and the damaging or beneficial effects that our words can have as practitioners on our patients. We also get a bit of insight into the unique Hunyuan philosophy in the approach of fertility treatment in particular, but also treatment as a whole. I will say, for those who are listening to this who don't have a background in TCM, there is a little bit of Chinese medicine lingo thrown in there, but it's nothing too much, and you're still going to get a lot of good stuff out of it. One last thing is the audio quality isn't the best. We recorded this on the fly using just one of our tablets. We have, however, updated our recording capabilities, and you can expect to hear much better audio in the future. But the content of our chat with Teja is just fantastic, so we hope you enjoy it. And if you have any feedback, any questions or thoughts, we would really love you to send them our way. We'd love to get a discussion going. Anyway, I'll let you have a listen to the interview. Thank you and enjoy. Yeah, I guess we were sort of most interested to start off with a little bit about your backstory. So you've come from a background of martial arts.
Yes.
And how that sort of led you down the road into Chinese medicine, and what sort of keeps you interested in Chinese medicine.
Well, it's all intimately connected for me. Because it started at the Martial Arts Academy that I now am the caretaker of. But I started there when I was 12, training with my master, Keith Blackburn, and to begin with, because I lived quite far away in Arcadia, so it was about a 40-minute drive to get to there. I could go just once a week when I started, but then I kept pestering to train more and more and more, and it was this, because I went to a small school, anthroposophical school, Rudolf Steiner School, and so like other schools would have, hundreds of kids in that year, our school had 15. And so when I started going to the Kung Fu school, it was this whole other world outside of my other little world. And I just fell in love with it, and my teacher in particular, and trained more and more and more and more in that. And when I was 16, 17, and I achieved my black sash in Kung Fu at that school. And then once I'd graduated from school, I was teaching there at the academy. And I decided to go to China and went on my first trip to China, to Beijing, and I was going to maybe explore possibilities of training in China further. In the mornings outside of the hotel there was a group of old ladies doing the young style 32 sword, and so I went to the markets and bought myself this old clunky sword, and I did the training with them, and in a week I'd learnt the form and was doing that with them. So the 32 form that I teach at the moment was taught to me by a little old lady
in the park.
outside of the hotel. Not on the park, on the sidewalk, right there.
Oh, right.
And they had all little telescopic saws, and I had this big, like...
Wooden.
Well, no, it wasn't wooden. It was solid steel.
Wow.
You know, crazy sword. And then when I was there at Tiananmen Square, it was quite a windy day, and a gentleman, maybe 50 metres that way, sneezed, and I saw it coming, and it got me right in the face. And then shortly after that, I came down with a raging fever. I had the Asian flu, and was ended up. The people from the hotel took me to the hospital. And at that time, when was that? 97, I think. 97, I think. They wouldn't treat foreigners with Chinese medicine, and so I was sort of treated with Western medicine in the hospital. But as I was getting better, I wandered around and got to see that there were rooms with hundreds of tables of people getting acupuncture on them, like huge halls of doctors just walking around jab, and then another one walking around taking them all out. And I was like, what is this all about? And then rooms of herbs being boiled up and then packaged up into little packages that got sent off with the patients, and the next thing over there was chemotherapy and whatever. It was all in this one place, and I was fascinated by it, particularly about the acupuncture at the time, because there was a little bit of talk from my teacher in certain points on the body, you know, striking wise. So then when I came back to Sydney, I befriended a local acupuncturist and started working with him, you know, helping him around the shop and watching him do needling, and he'd run a Qigong course, and I'd walk around helping people do the moves. And then I applied to uni and met Jacinda, and that was the end of that. Kung Fu at that time slowed down a bit for me because I'd moved to the city, and my school was out here, and I'd only ever trained at this school. And then, but once I graduated and we started working, my master got motor neuron disease, and 6-7 years ago he passed away of it. And so we asked then myself and another friend to take over the school, keep it going, which we've been doing since. And so it started at the academy, and then it sort of went into Chinese medicine. Now it's back there, and it's all one and the same thing, trying to get at the core of what we're trying to do with our lives, either from an external approach through physically training the body, or from a more internal contemplative approach through medicine. And this is how it should be. Medicine is not martial arts. However, I found that and recently very much so, found through my own experience of ill health and being in the hospital system and Western medical system, that is the other way around. Medicine in that form is a martial art. They're brutally attacking the body to try and get to the source. They're also trying to heal the body. It's all good intention. But the way they're trying to get it to is through martial arts. And martial arts is designed to break down our fears and our demons about, you know, particularly about our eventual demise. You know, like, I'm going to be attacked, I'm going to die. So I want to be able to defend myself and not die initially. You know, this is initial, I want to be able to have some sort of physical capacity. Then after that, we go, okay, well, I'm not so afraid anymore of that. But what else is there in deepness than the fact, well, eventually this demise will come, and particularly for me, because my master died young, he was 51, and I was there watching as he progressed from just a limp through to wheelchair and then bed and then the finish. Very clear picture of you know, life. And so for me, for medicine, I mean, these two have come together in that now I focus much more on my training on Tai Chi and Qigong, but Tai Chi, because it's a nice little bridge between the Shaolin Kung Fu and Qigong, is this area in between of Tai Chi where it's a martial art, but it's done in a different way and for a different purpose. And then with my medicine, it's trying not to be this martial artist medicine person, meaning I'm not there to attack the patient. or attack a disease, or any of these things, which initially is like the ego takes on board this thing of, this is what I'm going to do, I'm going to cure the world, I'm going to I've got this mentality, and we call it in the book the wounded warrior mentality, which is not necessarily, it's not a negative, it's just a state that we can't maintain forever. We have to grow through that, and for me it was through martial arts that I grew through that, and still am trying to grow through that. But when the patient sits before me, it's not my job to sit there and feel the pulse and say, oh, your kidneys are crap, oh, your spleen is crap, this is bad, oh, that's bad, you need me to do this and that. Feel the pulse, I say, wow, okay, this is good, it's got energy here. We just need to do a few things. We need to sleep a bit more. We need to change the food a little bit warmer food. Okay, yeah, this is good. Do you see? There's a difference. And trying to make it not about the doctor fixing the patient, but the patient being able to start to have hope.
Yeah.
And oftentimes it's the opposite. My pulse was felt very recently. And, my pulse 4 months ago was nearly not a pulse. So now, is it the strongest, bestest pulse in the world, and my kidney pulse was that good, and my spleen pulse was that good? They're not the best. But compared to where they were, they're improving. But my pulse was felt the other day by a TCM practitioner. Oh, your kidney's really low, oh, it's really bad, this is really bad, and bad. And I'm like,
there's a patient going,
imagining if it's the patient, and you're saying that to them, and it might indeed be the case in one level. Oh, there's some work to do here, but the way you present it to the patient is not in that way. And in Western medicine, exactly the same. That I'll say it's realistic. I'm going to give you a real picture of what's going on. I'm not going to BS you. And I'm not saying that one needs to BS, it's just the way of putting it forward, either a way of hope or no hope. And if it's the way of hope, it can't be the way, well, the only hope you have is by me fixing you. Meaning, oh, your pulse is really rubbish, you need to take my herbs to get better. This, and they may need to take herbs to get better, it might be the case, but what it does, and what we talk about in the book is, these words go straight in. The herbs go in and slowly do this or that or the other. But the words are there. And particularly with patients who are in pain or who are really sick, and I know this firsthand now because I've been there. I was in hospital and I had severe pneumonia, but they didn't know I had pneumonia. They didn't know what it was. And the tests were coming back like my blood pressure was still okay. Chest x-ray wasn't that bad. And so they're like, well, listen, it can't be that bad. And I'm saying, what about all these symptoms I'm getting? They said, it's anxiety. You're suffering a mental illness. And if someone hadn't gone through the process of writing the book and understanding the words of physicians and doctors, particularly a Western doctor, head of infectious disease at the hospital, who knows his business, saying, no, you've got a mental illness. If you haven't got that Gong Fu of the trying to be able to say, well, he doesn't know what he's talking about, then it goes straight in. And guess what you have? You have a mental illness. And you're treated with whatever Valium for pneumonia. Do you see the error in the medicine? So from understanding that when a patient comes in here, and then I know that they're coming in here, the only reason they're coming in here is because they're suffering. People who are happy and everything's fine, they're not in here, they're out in the sunshine. But people who are coming in here, they're suffering for one form or another. Particularly here with us is infertility, which is a deep, deep suffering for that woman and that partner, particularly with miscarriages, etc. And so then what you're saying, even though you don't want to be feeding them blind faith or what have you, the way you say it and present it to them is as much the treatment as the brilliant herbal and acupuncture combinations you can do, because of whoever you've studied with. You can study with all the masters in the world and learn the best formulas in the world, and yet you can ruin it by saying something that destroys the patient's capacity of having hope that their own body can heal itself. Because what will happen is, yes, your magical herbs and acupuncture will get the patient better, but they'll get sick again later on with something else, and they'll need to come back to you. And as opposed to trying to get the patient to a point where in the end, idealistically, there's no need for medicine anymore, Chinese or otherwise. That's sort of the biggest thing that I've sort of come to terms with in when we were in uni, we had Foundations of Sharing and Caring, I think it was, I can't remember the exact name, with two mental health nurses. And I hated that subject so much. They were saying, you got to be able to talk to the patient this way and use strategies to get out all the stuff from them. And I was so like, my modus operandi is my acupuncture and my herbs. Do you know what I mean? This is what I'm going to do. And I can feel the pulse, look at the tongue, and I can do the treatment. And I don't need to do some psychoanalyst stuff. And I really rebelled against that subject, really, really badly. And when we were in China a couple of years ago, we were talking to an herbalist who said, he wouldn't ask any questions, you just feel the pulse and write the script. And you just kept doing that all day and day and day. And that's really good. However, from working with Hunyuan stuff, he says that's not the case, that's not the ultimate level of medicine. And then I was able to go back and think about my experience with doing this sharing and caring course, which I really rebelled against. And the idea that I was rebelling against is there's some way of trying to manipulate the patient, which is to try and tell me your secrets about when you're a kid and you're abused, which really, I didn't want to have that level of intrusiveness. But there was an element of truth in what they were saying, in that you need to be able to talk to the patient. Not necessarily talk to them about their trauma and get to it in that regards, because that can even be more detrimental. But how it is you need to be able to talk to the patient to reinstill the capacity for their mental body to link with their physical body and understand that they can heal, they can get better, and that they're not fighting against their body. And if we don't do that, then we may cure the headache, but then we're going to have to cure something else and else and else, and they're perpetually a patient. So, even though it might never happen, the goal is to try and make it so the patient doesn't need medicine, Chinese, Western, or otherwise. And that's what I think Hunyuan is getting to in a lot of what he's talking about, is you talk to the person, bring them back to center, and try and bring them out of the chaos. And yes, some herbs is going to help the body, and the words will then help the heart. And then, like with the story of Xinfa, trying to collect yellow veins. Oftentimes, I'm getting lots of yellow veins, but then you realise, they're all black. Because the intention was there. Like the doctor's intention was good. He wanted me to get better. He said I had anxiety. Not because he was mean and horrible, but that's just what he thought. I can't see anything. I don't know what to call it, so I'll call it anxiety. But that's a black bean for him. And I guess the goal is to try and accumulate as less of those as we can, and more, particularly in medicine when we're dealing with patients, because of their level of suffering. The level of suffering is so, the mind isn't clear, the mind is scattered. And I'll just take some herbs. It's I've found so far, and I'm only young in this game of medicine, but I've found so far that that's not sufficient. I thought in the beginning that would be really great, The person is really angry because of liver qi stagnation. So I'll put in liver 3. That will soothe the liver qi stagnation, and the person's anger will abate, and they can vent it to whoever they like. I don't have to say a thing. I don't have to do much. What I have to do is just stick in the needle. Perhaps this is the case, but at the moment I've evolved or devolved out of that into this other state and can contemplate it further. But so I do both. I talk and needle. But my needling has become much more simple than it was beforehand. The point combinations and the analysis of what points do was very intricate. Knew the Chinese name of every point. Did all the study for it. Loved all that stuff. And could do very complicated treatments, very fancy. But what's the point of medicine? Help the body get better. be able to heal itself. Not you fix it with your miracle headache point. How do you help the body get better? And then there's only a certain amount of strategies you need to apply that to. So the patient is unwell. Why are they unwell? The body's dysfunctioning. Why is that happening? Okay, there's a couple of options. Therefore, there's a couple of point strategies. Strong, powerful points, not too many. Hit the target and then let it be, let the person rest. Is currently where I'm at with my thought process. That again, that might change back to fancy schmancy. But at the moment, that's where it is. And we'll just have to see what comes.
So you sort of feel like even in Chinese medicine we still have a tendency to get carried away with treating the symptoms and getting carried away into points and
100%.
Yeah,
that's our education.
Yeah,
our education in pattern discrimination, liver chi stagnasis, wood invading earth. Kidney deficiency, not able to control the fire in the heart, can't feed the liver wood. Liver wood gets brittle, cuts across, it hits earth. And then, okay, well, we're going to use Shayasan, or we're going to, and again, it's not that it's wrong. I don't think it's wrong. It's that when we keep asking the question, why? I got a headache. Okay, why have you got a headache? Liver chi stagnation. Why is the liver chi stagnating? No, can't use Shayasan anymore. Can't use Chai formula anymore. Because the reason the liver chi was stagnating was because of an underlying weakness. And the herbs that I'm using to treat the headache are herbs that are scattering herbs, defeating the root in the end. So that's why kidneys are down, Sha Yin is down if we want to use a different term. Why? Person's working too hard. Why? When you get to the heart of it, then, but what's our job is not. The patient comes in and says they've got a headache, they want a cure for the headache. That's our job. None of that other business. Yes and no. It depends on what level I think the practitioner is going to operate at, and when's the next patient? How busy are they? How much time do they have? I haven't got time to sit and talk to the patient about their lifestyle stuff because there's someone coming in 20 minutes and I've got to, you know what I mean? And this is maybe one of the issues as well, is that it has to be a business and flourish. But I think if we look past pattern discrimination and keep considering the question of why doesn't the body heal itself, then from what I've studied in Hunyuan medicine, there's something at the source that is not working. And what we need to do is encourage that. The headache's here, we encourage that. The endometriosis is here, we encourage this. The polycystic ovarian syndrome, the low luteal phase progesterone levels on the BBT chart. The movement is the same, regardless, because it's just a myriad symptoms on that. All the leaves are shattering like this, and we're going, oh crap, which herb? And then when it comes down to it, so well, there's not enough water down there, and we just can give the little tree some water, not spraying it with a little mister. And the leaves look wet for a second. There was I don't know if we put it in the book or not, but there was a quote from a bonsai master who was talking about a technique to reduce the leaf size on the tree. So we've got that tree out there, the leaves are about that big, but we want it as a bonsai tree this big, we want the leaves to be this big. How do you do that? How do you get the tree to make small leaves? There are certain techniques. Anyway, one of the techniques called full defoliation, which is you snip all the leaves off the tree and it grows back a new set, and you can snip them all off again, it grows back a new set, and every time you do that the leaf size is smaller. And this is total defoliation, not partial. And he said, yes, your leaves will get smaller, you'll have really tiny leaves, which is great, and then your tree will die. meaning that yes, I'm getting what I want. Do you know what I mean? I'm getting what I want, yay. And finished, because we're undermining the root. Yes, and the problem with TCM, not the problem, because TCM's wonderful. The main issue with TCM is oftentimes it works. The leaves get smaller. Yes, a success. I'm going to build an empire around these small leaves. And particularly for fertility work. Yes, I've got the lady pregnant. But what are we finding is that the current generation of children are living less long, healthy lives than their parents did. And never before in the evolution of the world has that happened. Why is that happening? And then when we ask that question, is Chai Hu the answer to the question? Or is another, or large intestine 4, liver 3 the answer to that question? Or is there another answer to the question saying, focus on the root, focus treatment on Sha Yin, on what in Hunyuan medicine they call Xinfa, which is a method of directing energy into the center. Simply just put energy here, the body does this. And when we do that for the infertility couple, regardless of endometriosis, regardless of polycystic ovarian syndrome, or all the other Western medical, physical, structural issues, when we do this, then what happens is Baba comes out with more center, more energy potential. So Bubs, hopefully in 30 years' time, does not come in and say, I can't have a baby. Mm-hmm. So we're trying to twist the cycle of kids becoming weaker to kids becoming stronger. Mm. It's got absolutely really nothing to do with the parents. As soon as the parents sit down in front and say, we're going to have a baby, they're irrelevant now. The point is, whoom, over there in the future, that kid. So all of their habits, they might smoke, they might drink, they might eat McDonald's, they might take Chai Hu. All of those habits we can very easily disregard. You're not smoking anymore. You're not drinking anymore. Oh, I like to do it. We're not talking about you. Mm. Yeah. It's not about you. It's about child and particularly grandchildren, as they're finding the link between us and our grandchildren and our health. And so, you know, some people say, oh, we don't treat infertility because, you know, if they can't have a baby, they can't, and that's natural selection and tough bickies. However, if the reason that they can't have a baby is resolved by bringing the person back to centre, not only will they have a baby, they'll have a healthy baby. Mm. And our work with IVF, IVF only does separation, no unification, or only takes energy out of the body and makes more stuff, make more follicles, or shut down the system. Whereas, you know, Chinese medicine should be doing the opposite, bring the energy back to centre with herbs and acupuncture. That's it. And then the way we facilitate IVF is we do this, they do that. However, contemporary acupuncture and herbal medicine tends to want to follow with what we will support IVF by doing this, and the treatment tends to be scattering or moving the qi, scattering the qi, because the circulation is restricted. Why is the circulation restricted? You know, there's qi stasis. Why is there qi stasis? Why is there tension like this? What is tension? Well, tension happens when your body gets cold. You go like this. When you get warm, you do this. So tension is cold. And a lot of the herbal medicines that we tend to use, particularly from formulas we trained in from university, a lot of them are cold. And that comes down to the idea of heat, and there being evil heat, toxic heat, and then saying, well, hang on, so a dead body is cold. I put my hand on the dead body, they're cold. I put my hand on someone who's alive, they're warm. Structurally, the two bodies are the same structurally. There's blood, there's brain, there's organs, heart, liver, whatever. In the blood I can see their last meal, I can see proteins, minerals and vitamins. So structurally they're the same, but there's a temperature difference. This is cold, this is warmth. Thermodynamics. Simple thermodynamics is all Chinese medicine is about in my mind, in that if we understand that we're nothing to do with this side of the cold business, nothing to do with that. We're in medicine, which is here, about warmth. If it's about warmth, which is circulation, and that's why we're doing this circle all the time, and Hunyuan, Tai Chi and Qigong is always about these circles, and we draw every patient I see as a circle, and I talk about the circulation. Then if that's our purpose and our goal, if we're seeing toxic heat and we're getting rid of the heat by use of icy cold medicinals, antipyretic medication, antibiotics, anti-inflammatory, whatever, anti-whatever herbs as well, because we can study the herbs and find out the pharmacology of the herbs that have antibacterial, anti-pyretic, anti means against. So, and then we can apply herbs that way to say, well, you've got a strep throat, let me give you an anti-whatever herb. Western medicine does that far better than us. Our job is something different. So we see the heat, we see the toxic heat, and we say, why? What does that mean? It's toxic because it's in the wrong spot. it's in the wrong place. Or hot flushes for the woman at night time. It's because the heat is coming up to the surface when it should be down here in the centre. So if it should be down here in the centre to keep her alive and more cycles, health better, then is my use of bitter cold medicinals to clear the heat, is that on target or off target? And the same applies with all these conditions, in particular autoimmune diseases now seem to be described as these heat, and this clear heat with lots of shengdi. I see the eczema on the skin, lots of cold bitter herbs, because I see the heat and I want to treat the heat. But remember what happens to the human body when we get rid of the heat. That's for later on. That's not our business. Our business is here in the realm of the living person, which is circulation, which is warmth. And warmth in the right spot, at the right time, being appropriate. That's why I said to you in the message that being appropriate, we need to sleep. We need to do these things appropriately. But when we're younger and our ego drives us forward 1,000,000 miles an hour, then we miss that, you know what I mean? And it takes a life-changing event to go, okay, I have to practice what I preach. I have to listen. The reason why I say it every day in clinic is not so the patient hears it, but that hopefully one day I myself may hear it. Then it goes in, and finally I understand. Yeah, now I get the idea. Because who's the most difficult person in the world to deal with? It's ourselves. You know, and this is the martial art training, is getting over that, our fears or insecurities, etc., through the physical work, and then equally so from the medical work. But if you think that the Chinese medicine practitioner is about just putting acupuncture points in and giving herbal medicines, then it seems like that's at a certain level of medicine, the barefoot doctor level of medicine, which is not wrong. It's not saying that's bad. You're trying to help the person. But because we're always trying to improve ourselves and cultivate further, then we need to move beyond that. And then we get to here. And then how do we move beyond that? How do we move beyond that? And that's the trick for me at the moment, is because I've written that book all about these things, about Xinfa, or the method of the heart, what's happening in the heart, and then everything else stems out from there. And then here I go and I get myself so sick that everything breaks down, and the body and the mind are torn so violently apart. To be able to find one centre again is a huge challenge. Huge challenge. And it's easy to say it and write it in a darn book when you're okay. But when you're in the throes of it, you get to really see the difficulty and the importance of it, because I was really sick, but Western medicine did not have an answer. And somewhere in the back of our minds we think we're going to do Chinese medicine, that's fine, but when we get really sick, Western medicine will be there to back us up and help us out, as it should be. That's its job, is to save damn lives. And indeed they did save my life when they put the drip in, because I had no blood left. But could they then say what was wrong and how to cure me? There's no answer. They did not know. They still do not know. All the tests in the world, they don't know. So when we think of the most elite level of medicine, a lot of the time they just don't know, have no idea, but they apply medicine to it. They have to apply treatment to it. I don't know, so therefore I will use formula A, B or C, and then we'll just see what the disaster happens. And then we've changed tactics. We still don't know. We call it in the book, well I called it in the book, playing darts in the dark. And Yaron famously says, when in doubt, don't treat the patient. And TCM would say, when in doubt, let's treat the spleen, or or whatever our habit might be. When in doubt, let's use yin tongue, or let's whatever. And that really stuck with me when you said, when in doubt, you don't treat the patient. So you can't get away with not knowing in Chinese medicine. You have to continually, and then we say, well, I do know it's liver qi stagnation, therefore I'm using liver 3 and Shaoyasan. And then, okay, it's like saying, I do know I've got a headache, so I'm going to take Panadol. And guess what? The headache goes. I'm going to take the Panadol. Yay, Panadol works. And if the point is, patient should not need medicine in the end, then we need to keep digging at that and not just sit on the surface of, okay, we'll treat the liver. And in no way does this mean I've found the solution. In no way does this mean I have people that don't get headaches here, even with my best intentions and best treatment strategies. However, continually things are improving in their general health, and that's why I need to keep studying, keep cultivating, is to try and get better at doing that. And it's the patients that don't get better and that still struggle but still come to see you that drive you on. All the success stories and all the babies and things that have happened, they sort of just vanish because you're just, damn it, this is patient and it just won't get better. And I'm doing everything right. I'm doing this. I've done everything. What more? I need more. There's one particular patient, that's why that book was why I agreed to do that book. And so, unfortunately, the job of the physician is never ending and it's arduous. But at the same time, when practicing in that way, in the end, then the heart is at peace because we know we're doing our very best. And not just formulating a successful business, that will support our families, which is important. But at the same time, in medicine, it has to be something a bit more.